Hello and welcome to this episode of Peak Life. Today we're talking about a really important topic, colorectal cancer. And here to talk about that is one of our resident experts from Chesapeake Regional Healthcare, Dr. Tahilramani. Did I do it?
That's right. You did it perfectly fine.
Yay,
And thank you for having me here today.
Thank you so much for being here. So, this is yet again another one of those health topics that a lot of people don't want to talk about, don't want to think about, don't want to jump into, but it's really, really critical. Tell me about colorectal cancer. How common is it? How much do we have to worry about it? That kind of thing.
Colorectal cancer is a very important topic, and I think it's becoming more and more visible because a lot of younger patients are getting diagnosed with it.
Oh, wow.
And, the screening guidelines used to be that start colonoscopies at the age of 50. We've dropped it down to 45 years.
Oh.
And so it is becoming something that is more common among our younger patients, and that's why we're kind of bringing it forward and being more aggressive about offering the colonoscopy screenings at this time to our patients.
Okay.
So
you say 45 is kind of that time
45
frame when you
is
got to start thinking about it and make that appointment.
That's right. 45 is the magical number now.
Okay.
And we want to keep in mind.
Is there anything that should push someone to go sooner? Like, do you have symptoms with colorectal cancer?
So anyone who has anything that makes them feel abnormal as far as their GI system is concerned. So if you're having rectal bleeding, you're having pain around your bottom, you're having abdominal pain, any symptoms of weight loss, you used to have normal bowel movements and now you're noticing that you're feeling constipated or having diarrhea, anything that is just not normal. And it's whether it's for colon cancer, colon screenings, but for any other disease processes, I just tell the patients, just run it by your doc and ask them what they think about it and if there's anything that you need to worry about.
So you can start just with your PCP, being honest about changes in, something's off, what should I do? I
totally recommend that. I think our primary care physicians are like the forefront people that you should first reach out to. Inform them, and then they'll direct you. So, I have patients coming into the office all the time, and it may be rectal bleeding, and it may be as simple as a hemorrhoid, but then often sometimes we'll catch these unusual things, and, go to your primary care, and they will send you to the right people.
I feel like that's such a good rule of thumb, really, for everything. I mean,
that's correct.
If all of a sudden something with your health starts to change, don't wait, start asking questions, right?
It's like your car. You don't want it to break down. Just take it to your auto shop.
It'll just get worse the longer you put it off, right?
That's correct.
Yeah, okay. Talk to me about the process of getting a colonoscopy, right?
That's correct. Colonoscopy, I think a lot of patients will come in and they have this image that it's going to be a really horrible study and it's going to be totally painful.
Right.
But it really is not. I do tell patients you have a day of misery, but that day of misery is really just you running to the bathroom to sit on the toilet.
Okay, because that's not the prep, right?
It's the prep. And the preps have changed over the years that now we have a lot more palatable versions. We've got just pills, we've got smaller volume.
Oh, wow.
So it's not as horrendous as it used to be in the past. And people don't get scopes done more than once every 3, 5, 10, depending on when they need. So it's a long time since then that you have to go through this whole process. And then the day of the scope, it's pretty chill. You come in, anesthesia sees you, they put you to sleep, you have no idea what's going on, you're completely comfortable during this procedure, and you actually wake up like you've had a very restful sleep. And then go eat something outside.
Sounds great.
And that's perfect. So it's really not a difficult. I think it's perfect, as long as you qualify for it.
Yeah. So you say once you get one, if everything comes out clear, it could be a few years before you even have to go back.
That's true. It means if you don't have risk factors, you don't have polyps, you may not even need another one for 10 years.
Oh, wow.
So it is totally worth the one day of running to the bathroom.
Yeah, absolutely. Now, what about family history? Does that play a part in this as well?
Family history makes a huge difference. Family history will sometimes urge us to have our patients come in for colonoscopies earlier.
Okay.
It depends on, first degree, whether your parents have had it or grandparents, depending on what the closeness of the relationship is as far as polyps or cancer. And then, your doc can walk you through that pathway if they want you to come in earlier, or we might just put you in a little bit more frequent surveillance visits. But again, it's not like you're having to do it every month. This is, again, we're talking about years in between your exams. So it's really something that is very doable. And I think patients should pay attention to that.
So with all of these things, even with mammograms and blood tests and stuff, I think that buildup of fear is really so much worse than the actual process. So I mean, you're saying it's like a day of a fabulous cleanse, and then you go in and you have a great nap. So really, there's nothing for people to be afraid about or to delay.
It's really not. And we do have other tests that we can offer patients, which are not like the top recommended test necessarily. But that said, you can kind of play around and offer these tests based on your comorbidities, your health problems, whether we do some blood tests, stool tests, whether we do just small endoscopies, we send you for CT colonographies. There's other options on the table.
Okay.
But my point being that anytime there's an issue, just go talk to your primary care, and they can send you to either colorectal surgery or to gastroenterology, and we can then further direct you which would be the best route for you.
Now, you mentioned the other options, and I have heard about the take-home tests, like the at-home.
Yes.
Are those worth it? Are they valuable? Or
They have their, everything has its pros and cons.
Sure.
The advantage of doing the colonoscopy is that, we have a better visualization. If there's small polyps, we can remove them at the same time. Those studies are better when we have, maybe a higher risk patient that we don't want to put them necessarily through a colonoscopy. Or they're at ages where they're getting older and maybe it's not necessarily, we don't need to be necessarily that aggressive. So it has its variations because those are more diagnostic tests and we cannot necessarily do anything except then have you then go down the path of the colonoscopy for the therapeutic if there's a concern for a polyp or something.
You could just have to end up doing that anyway.
Yes,
Yeah.
but at the same time, there are options, and
Okay.
that's the main thing. There's options, and therefore evaluation is always recommended.
Do you see more women than men, more men than women?
I think as a female colorectal surgeon, I do. At least, that's what I feel, that a lot of my
Okay.
patient population half the time is, more than 50% is women. And, there's a lot of stuff in the anorectal world specifically that is very sensitive. Fecal incontinence is a big topic, and I think as women we can relate to it because it's a topic that happens, or is a disease process that happens mostly in women.
Okay.
And now there's so many treatment options. That it does result in social isolation. We don't want to be intimate with our partners. We don't want to go outside. It really affects our quality of life, and so now. Dietary changes, pelvic floor therapy, sacral nerve stimulators, which we can do at the hospital. There's so many options to offer our patients. So I do find myself finding a lot of women coming down, and it's awesome.
Yeah.
And so, we just want to make sure that these options are available to our patients.
Well, it sounds like there's a lot more going on down there than I ever even realized. So great to know. Dr. Tahilramani, thank you so much for being here and for giving us a little education.
Oh, it was my pleasure. Thank you for having me here.
Absolutely.
Thank you.
Thank you so much for watching this episode of Peak Life. We'll see you next time.